The medical physics residency program at UT Southwestern is distinct in its opportunities for collaboration, the availability of technology, and the opportunities for research.
Our goal is to develop each resident towards independent practice over the 2 years of their residency. At the end of the residency, each resident will have both the confidence and experience to work in any clinic.
The medical physics residency program is one of the largest in the world. We admit 4 residents per year. That provides opportunities for collaboration with fellow residents, for sharing of information, and for bouncing new ideas off one another. Medical physics residents will collaborate with medical residents, PhD students from the biomedical engineering program, as well as dosimetry students. The UT Southwestern system is a very large medical center. We provide service to a large array of patients here, including Parkland Hospital and Children's Hospital. And so residents can expect to see almost any kind of treatment that's currently performed in our field. The breadth of our technology at UT Southwestern is extraordinary. Residents are expected to learn this technology in their clinical service, as well as through 8 clinical rotations. Residents can expect to attend and be involved in tumor boards for urology, neuro, radiology, for example. The people you train with are very important. Here we have over 65 faculty members, physicists, physicians, and molecular biologists. Residents are exposed to all these individuals, including some that were very much founders of our field. We're concerned about our residents' professional development. So when a resident starts in our program, we pair them with a single faculty member that follows them through their entire 2 years in our program. But the resident will also rotate through individual mentors that cover specific clinical topics and specific disease sites.
Residents work as colleagues in a team approach, from learning treatment planning techniques from physicists in their service to conducting dry runs of adaptive therapy. They'll also learn to interact with therapists and physicians. This collective experience is definitely a plus compared to other programs in the US and worldwide. Residents will be involved in clinical tasks from the very beginning of their residency. We do quality assurance measurements on each of our linear accelerators, daily, monthly, and annually. In addition, each evening we deliver next day's treatments to phantom devices to ensure patients are treated safely tomorrow. Our program is designed to get residents immediately involved in our new treatment modalities, which offer unique training experiences. Each treatment modality has a physics service responsible for it. Residents will join each service during their time in the program.
The Department of Radiation Oncology offers several courses, and all these courses are available to our residents free of charge. For example, residents will gain a certificate in gamma knife training during their residency program. A certificate in gamma knife training is beneficial because a certificate is necessary to practice gamma knife.
This is unique, as only 4 institutions have a gamma knife training course, yet we offer this as a standard part of our residency.
Residents are encouraged to participate in research while they're here. The 3 divisions in the Radiation Oncology Department support research: clinical, translational, and basic. Research projects currently ongoing in the medical physics division are normal tissue toxicity, adaptive replanning, GPU and cloud-based automated treatment planning, GPU Monte Carlo packages. The director of medical physics for our department is Steve Zhang, who operates a very large artificial intelligence for medical physics laboratory.
A very strong research direction in our medical physics division is AI research. We try to develop and deploy AI technologies in the clinical practice to help patient care. We are one of the leading groups in the world in this research field, and residents will have a very good opportunity to be part of this team. This is a very rare opportunity for a lot of medical physics residents.
This is actually a very exciting era to join the Department of Radiation Oncology at UT Southwestern.
We've opened an additional 71,000 square feet of space, housing the next evolution in radiation oncology, adaptive therapy, that combines advanced planning techniques and high-resolution imaging to quickly tailor treatments to changes in patients' anatomy and tumor size and allow us to deliver ultra-precise treatments each day. This new expansion houses 7 new linear accelerators, including state-of-the-art MR-guided systems and second-in-the-world PET-guided system. This brings our total to 14 linear accelerators in our 2 adjacent buildings.
Now, why is this so exciting and why is this so awesome? And the answer is because this is what I call the mother of visualization during delivery. Everything can be actually adapted and morphed to actually match the patient's system right now when the beam is on.
This new technology includes 2 unities for MR-guided therapy. This allows us to see the anatomy that we treat, even while we're treating, and adapt to this anatomy and deliver the most conformal dose. In conjunction, we have an MRI simulator that enables MRI-based planning for all our linear accelerators. This allows for more accurate tumor definition and measurement of tumor response. The expansion also houses 2 ethos for routine daily adaptive therapy, 2 Halcyon, and the Reflection PET linear accelerator that introduces biologically guided radiation therapy.
With the opening of our new facility, there are going to be many opportunities that are very unique for a physics resident. We have to accept and install all of our new technologies. Residents will be on the forefront of that effort. These activities are activities that you might only get to do once every 5 or 10 years in a normal clinic. But at UT Southwestern, it's a routine. In the rest of this video, you're about to hear from actual faculty members in our department, experts in their field. These are the people that you would be training with if you come here.
Medical physics research is a very broad area that utilizes a lot of technologies, and also we develop technologies to solve problems that we see in the clinic. For example, we have big groups doing a lot of computational-based research. Unique to UT Southwestern is we do a lot of artificial intelligence using those technologies to solve clinical problems. At the same time, we also have groups working on the new hardware technologies to better treat patients.
In coming to residency here, I knew I'd get a good balance of what you need to learn as to be a medical physicist and also the novel things that are being developed in the field. The 3D printer lab is primarily used as a way to make customized bolus. You can also make phantoms, which are used for imaging, or any other customizable device you might otherwise not be able to make. So essentially with 3D printing, if you can think about it, you can probably build it. It's still relatively new, so getting good training with it and being familiar with how to design things that you can then print is definitely a benefit in the future. Essentially, what you're bringing to a clinical environment is something that you would have a machinist with a CNC machine do before, but now you can do it at your desk and then have your printer replace that machine shop.
Within the central nervous system team, we have tremendous technology. This allows us to be more flexible in the treatment algorithms that we can apply to patients.
UT Southwestern has technologies that are unmatched anywhere in the world. We always are trying to push the envelope. SABR treatment is actually increasing the length that people live, and some people are actually cured even with previously uncurable cancers.
At UT Southwestern, we specialize in delivering cutting-edge treatments and radiation for breast cancer. We have 2 machines that we can offer these treatments on. The CyberKnife that can track the patient's breathing during treatment. The other machine is called the GammaPod. We are the 2nd institution to have the GammaPod in the world.
We are at the forefront of applying modern technology in the use of radiation for the management of all our cancer patients. We have one of the largest clinical trial portfolios of any radiation oncology department worldwide.
Our office space was designed to bring physicians, physicists, dosimetrists, and support staff together around a certain disease-oriented team. We call our office space the tube, and the tube is often where patient care decisions and collaboration take place. Our department has dedicated space for residents' cubicles and for their collaboration. Often the best discussions occur in the common areas and conference centers in the department, where we have coffee, espresso, and tea available 24/7. Consider that during your residency training, you're going to spend a lot of time at work. You want to spend it at a place like this.
A resident here, at least among the other residents, really tries to have an environment where you always have help for something you're not sure of. And that's something I relied on heavily, and I know my other co-residents did as well, is we really try to support each other, which is definitely not common in this field, where most programs have one, maybe two residents at a time. Depending on your interest, there's quite a bit to do outside of work. It's quite a nice place to live because everything's available and there's lots to do. You have a professional hockey team, basketball team, football team, baseball team, all here, right? So for me, and it's great.
As a residency director, it's my privilege to watch residents grow when they get here. All of our residents have graduated with employment. The department views residents as essential. Residents bring in fresh new ideas and fresh young minds. We really appreciate residents when they come in and bring all their expertise and their knowledge and their personalities. As we recruit residents, one of the primary qualities we look for are people that are innovators, people that don't just want to learn how to do procedures, but people that want to make the procedures better or develop new procedures to conquer certain disease sites. In our department, we're constantly innovating. Residents are going to be in the environment of innovation. They're going to see it firsthand, and they're going to be able to innovate themselves. We have the opportunities here to do that.